words, followed by Dr. Mark Escott, Interim Austin Travis County Health Authority, and then Austin Public Health's Chief Epidemiologist, Janet Pichette. And then we'll open up the mic to our pool reporter who will ask questions on behalf of the media. Stephanie?
This is a reminder about the local mandates. We applaud the governor for continuing the mask for all participants for the state of Texas. But we want to remind everyone that we have our local orders that are in place, and we want to adhere to those orders. We really encourage you not to gather. We understand that there has been a change to the capacity, and we encourage you to not gather. If you go to a venue that has a lot of people there, we encourage you to make other choices. We also continue you to establish traditions and just keep you and your family and your loved ones safe. This is just a reminder about the RISE funding. That process is coming to a close, and we would like everyone to call the call center or log on and receive that information. And also, we have the rental assistance available. Thank you.
I want to start by echoing Director Hayden's comments. We're certainly grateful of the governor for continuing the mask mandate. That remains a excellent way for us to mitigate the risk of spread of disease in our community and across the state. We also recognize and appreciate the governor's decision to keep bars closed. I know some folks have called this unfair, but it's unfortunate. It's the way the businesses are designed, where people are gathering together face to face for an extended period of time. And I echo the governor's sentiment that bars have to find new ways to operate in order to make them safer, to put them in a place where they can reopen. I want to mention something about opening things up further. I understand where the governor's coming from. We would have preferred to wait a little bit longer. We wanted to wait until we were at stage 2 of our risk so that we could be a bit safer when we open things further. And that's particularly concerning because over the past 2 weeks, we've seen an increase in our number of new cases. On September 3rd, we had a moving average of 69 new cases in Travis County. That's increased 83% in the 2 weeks since then. So we're seeing increased cases. Where are those happening? The highest positivity right now is in 2 groups, 10 to 19-year-olds and 20 to 29-year-olds. When we look at that data further, we know that college students have a positivity of around 10%, which is more than double our community risk. When we look at high school students, their positivity is 14%. So triple what the community rate is. So it's important for those individuals, our young people, to make sure that they're acting in a protective way. I know people are scared about sending their kids to school. I will tell you that the data that we have in hand right now, we have about 4 dozen cases in the secondary school setting in Travis County. We have hundreds of cases in the college setting in Travis County. We don't have any evidence right now that any of those cases were transmitted in a classroom setting. So where are they happening? They're happening in social gatherings. They're happening in extracurricular activities. We've seen clusters in the area related to football, strength and conditioning, football practice. We've seen it in cheerleading. We've seen it in band. We know that these activities are likely to present situations where masking and social distancing is not possible or practical. So it's important that parents understand that they understand those activities bring an increased risk of transmission for those children and for the household. And because of that, We also recommend that those children, if they're going to be active in those programs, mask and social distance at home to protect the rest of the household.
Good morning. I'd just like to bring up a few points. One, and inform the community that Austin Public Health has been regrouping currently as the case numbers have been increasing since Monday. And we stand ready and have created some additional strike teams, which I've mentioned in the past, to focus specifically on schools, primary and secondary education, as well as higher education. I also wanted to bring up that there remains testing capability in the community. So if you are experiencing symptoms or need to be tested, that availability is out there. When in doubt, check it out. And 3, fall is fast approaching, and it is the beginning of cold and flu season. And so now is the prime time for you to get your flu vaccination before there's a run on flu vaccine. It will provide additional protection to those from respiratory illness.
Thank you, panel members. Now we're going to go over to our pool reporter, Hannah Rucker, who is representing KVUE. Hannah.
Our first question for you this morning is, although bars are still technically closed, is there any concern with the amount of downtown bars that have kind of found a loophole when it comes to providing food and causing groups to gather again? We're definitely seeing more activity downtown because of that.
Yes, we're concerned. We're concerned when people are gathering together face to face for an extended period of time. If that's in a bar, if that's in a backyard party, or other social gathering. I think it's important to remember and to remind folks that we are at stage 3 of our risk, which means we're recommending folks avoid gatherings of more than 10 people. We're recommending that folks who are at high risk avoid any gatherings of people outside of their household. The disease is still out there. We're at the place we are now because of the measures that we've put in place and because of the protective actions people have taken. If we take too much risk now, we're going to pay for it in the fall. And we've got the other threat of influenza coming as well. So you have to be very concerned about that. My recommendation for bars, as I said earlier, is that they look for other ways to operate so that they can be done safely. Generally speaking, if people are seated at tables that are distance apart, it's going to be safer than the traditional bar setting where people are crowded around a bar and creating an opportunity for this disease to spread.
As Dr. Escott stated, we are very concerned. We have increased our enforcement efforts. Our teams will make regular rounds in those areas to ensure that the owners are adhering to the local mandates. It is important for us to provide technical assistance, but it is a system that enforcement does come in hand. So we are able at a point where we can provide enforcement and move cases along in our system.
Wonderful. Our next question comes from CDS Austin, and it's also regarding the governor's announcement yesterday. It says, do you think that the governor's relaxing of the restrictions is appropriate for the Austin area? What do you think the impact will be of 75% capacity at restaurants, gyms, and offices?
Again, we would have preferred to wait until we were at stage 2 of risk. And that means our hospitalization 7-day moving average is under 10. And again, we'd like to see our positivity rate less than 3% before we were to make that recommendation to 75%. I think ultimately people are going to need to make that decision for themselves. If they go into a place and intend to have a meal and find that it's crowded, you should look for someplace else to eat. I am pleased that the governor continued the 6 foot of distancing between tables, or 4 feet with a physical barrier. I think it's going to be challenging for a lot of restaurants to get to 75%, with those measures still in place. We're not entirely upset with the governor. I think the governor is trying to balance the risk to our health and safety and the risk to the economy. I think we're probably a couple of weeks away from a position where we would have supported this. Again, families have to decide. And I want to remind folks that if they are high risk, they have underlying health conditions, or they have someone living in their household that has underlying health conditions, they should not be taking risks.
As a reminder, we have our tools that we have put in place at the local level. As I stated earlier, just a reminder about the local mandates that our mayor, health authority, and county judge have put in place. We also, as a reminder of our risk-based tool we have on our website, we really want people to continue to use the resources that we have on our website that will really help you as an individual to make the best decisions for you and your family. But we know it is an individual decision that folks will want to be more mobile, but we want you to adhere to all of the mask mandates, the hand hygiene, and the social distancing, whatever your choice is going to be.
Thank you for that. And the next question comes from KUT News. It says, on Tuesday, Dr. Escott said high school students in the area have a 14% COVID positivity rate. As more kids in the area head back to the classrooms in the coming weeks, what concerns you most when it comes to increasing capacity in schools?
So let me start by saying we chose the phased-in approach to give schools and school districts an opportunity to see how things were going at 25%. And the recommendation to move to 50% if things were working well. If they're not working well, they need to reconsider whether or not it's the appropriate time to move up to 50%. If they have identified areas of risk, modified their procedures, and then move to 50%, I think that's okay. But recognize that as we've been saying all along, schools are not going to be able to prevent 100% of cases. What we're trying to do is prevent substantial outbreaks within schools. And that's going to take that partnership between public health and our school districts to do that. So again, it's going to be dependent upon the individual school district, and I think I think they're doing a great job of informing their community. Many school districts have created a dashboard to provide information, school-specific information, and I think that engagement's important so that families can make an informed decision of whether or not they want to send their child into the classroom.
Wonderful, thank you. And the next question comes from Austonia. It says, positive rapid antigen test results continue to be classified as probable cases rather than confirmed per CDC guidelines. Does APH have a sense of what portion of COVID tests conducted in Travis County are rapid versus genetic, and whether the exclusion of rapid test results is affecting our understanding of community spread?
So I'll start, and I'm sure that Janet may want to add something. We are, again, as you noted, reporting in the normal convention of the state and federal government regarding PCR tests as confirmed cases. We are looking at a way to display also the probable cases based on antigen testing. And so folks understand the difference. The antigen testing is fairly good, fairly accurate. In some circumstances, it may be a better measure for us in the future to determine whether or not somebody is infectious or not. So I expect that we may see some changes in how the state and federal government want to treat those cases. But for now, we're looking at options to display both the probable and the confirmed.
Wonderful, thank you. This comes from Co-op Radio, and this is also in regards to the governor's announcement yesterday with the 75%. It says, recently, dining in restaurants has been singled out as being as likely to spread COVID-19 as bars by the CDC. Highest risk on-site dining with both indoor and outdoor seating. Gyms have consistently been considered one of the more risky locations along with bars. How then is it that both are allowed to expand to that percent occupancy to 75% while bars remain closed?
Again, I think gyms are concerning. Obviously, somebody who is running on a treadmill and breathing quickly is going to have the potential to spread disease. This is going to be dependent upon gyms ensuring that people are spaced apart and that appropriate cleaning is done. But again, it's going to be increased risk compared to not going to the gym. But folks are going to have to understand the risk and make a decision if they want to do that or not. Regarding restaurants, I think it depends on the protective measures in place and who you're dining with. If tables are spaced 6 feet apart and you're dining with members of your household, it seems logical that the risk in that circumstance is not going to be very high since you're in close contact only with other folks that you normally have close contact with. When restaurants get crowded, the concern increases. When restaurants are not abiding by the safety precautions, risk is going to increase. So I think we've got to pay close attention to that. The other thing to understand in some of these publications is that there's an association. They've described an association between people who are COVID positive and having been to a restaurant in the appropriate period of time to be infectious, the previous 14 days. That's different from causation. That's where they got the disease. So it may be that people who are frequenting restaurants are also taking other risks which may expose them to COVID-19.
Just as a reminder, our environmental health staff, with each phases, we were at the 25%, now we're at 50%, and then 75%. Our environmental health staff have been available to provide technical assistance and really work with the restaurants hand in hand to ensure we create a place where it is very safe. As I stated earlier, we initially start with technical assistance. We move to warnings if there is non-compliance, and then ultimately it can move to be a fine and potentially closed. So we will be using all of our tools that we have available through our environmental health team to keep Austin safe.
Wonderful. Thank you so much for that. And the next question comes from Texas Tribune. It says, do you see evidence that the return of UT Austin students / resumption of classes has led to community spread in Austin? Is there any estimate of how many cases in Austin are related to UT?
So we've had community spread for months in Austin. When we look at the UT cases, they account for the first 2 weeks of September, they account for almost 40% of all of the cases in Travis County. So certainly it's a significant factor. The high school students are a significant factor. And we are working closely with the University of Texas to keep a lid on that spread. Again, we know that high school and college age students are far less likely to be hospitalized and far less likely to die from COVID-19. We have to make sure that they are not spreading this to other members of the community. And we've engaged those students. We've engaged the fraternities and sororities We've been engaged for months with the University of Texas and other universities to ensure that the messaging is appropriate, that the testing is available. And we certainly encourage folks, college students, high school students, other members of the community who've been in social gatherings where masking and social distancing was not practiced to get tested. It's important for us to be able to identify folks who are asymptomatic or pre-symptomatic, but still have the risk of spreading to others. And I think if we can engage in that practice as a community, we can keep things under control.
Perfect, thank you. Our next question.
I would just like to add that, Austin Public Health and UT have been working very, very closely together. Again, we've established a higher education strike team to assist in any clusters that may occur at the university or other institutions of higher education. We are also meeting with them regularly to help intervene when we can. And we do have an interlocal agreement with UT Austin, and they assist with our case investigation and contact tracing with specific emphasis on that college aid, those students that are on their campus. So again, we've been working very closely with them to make sure that we stop the transmission cycle in those settings.
Wonderful. I'm glad you added that. Thank you. And the next question is from KXAN, and it's also pertaining to the update yesterday with the governor, but this one's aiming more with nursing homes. It says, do you think the latest expanded business capacities and nursing home visitations are prudent given our current landscape?
Again, we are still in our stage 3 of risk, which means we're still concerned about the rate of community transmission. I think in particular, when we look at nursing homes and other long-term care facilities, family members of these individuals need to be very careful. If they intend to visit an individual in one of those facilities, they should act in a more protective way than even stage 3. They should act like they're in stage 4. They should avoid social gatherings. They should be staying home in the 2 weeks prior to visiting. We know that COVID-19 is devastating for nursing homes and other long-term care facilities, and it's prudent for these individuals, these family members, if they feel it's necessary to visit their loved one in person, to protect them and protect other members of that facility by acting in a safe way prior to visiting.
And I'd like to add, not only should those family members be concerned with COVID-19, but we are entering into cold and flu season. They need to make sure they're getting their flu shot before they enter into those facilities. They need to make sure they're monitoring other conditions that may be placing those people at risk, like norovirus is another example. It's that time of year where nursing homes tend to have a lot of norovirus outbreaks. But we do have a nursing home strike team that stands ready. They have intervened in cases when we need to do some infection control assessments, or we make requests from the state to assist with that effort. So again, we are ready to work with that business sector.
Perfect. Thank you so much. And our next question comes from Univision. It says, we have been seeing parties among college students. Are they getting cited? What will it take for these students to face penalties?
So as Director Hayden said earlier, we have a group working on enforcement. That group includes Austin Code, the Fire Marshal's Office, and our Austin Public Health's Environmental Health Services. We're working in cooperation with the University of Texas. Generally, if there's issues on campus, the University of Texas will handle. If it's an issue off campus, the City of Austin will handle it. We rely on people reporting to 311 to notify us of parties that are ongoing or parties that are planned so that we can intervene. We, again, start by doing an assessment. If there's a violation, sometimes they'll get a warning. If it's a serious violation or a repeated violation, they'll get a fine. People have to remember that these are lawful orders to not have gatherings larger than 10. It is a criminal penalty for violation of that. If that violation leads to serious injury, illness, or death, those penalties could be much more serious. And I would certainly support our district attorney in pursuing criminal charges against a entity that holds a party that leads to transmission disease and a serious outcome.
Wonderful. Thank you for that. And the next question is also in regards to UT. It's from Community Impact. It says, on Saturday, we saw far fewer than 25,000 fans at the UT football game, and about 8% of the UT students tested were sent home after testing positive. There are 4 more home games on campus scheduled. After seeing the process, do you feel any differently about the university's plans for home games than you did last week?
Again, we're pleased that the University of Texas took additional actions. They reduced from 50% to 25%. They screened the students in advance, and we've just described that students are at higher risk, significantly higher risk than the rest of the community. They ensured that people had masks on entry. They had people spaced out at the beginning of the game. However, we had some teams from Austin Public Health at the game, and what they observed is that as the game progressed, the mask came off and people started gathering close to the field. There was a stark difference between what we saw on the TV cameras at the UT game versus what we saw at NFL games, where social distancing and masking were enforced. So our feedback to the University of Texas is that if you're going to continue to have people in the stands, that you've got to continue the enforcement throughout the game to ensure that those activities can be done safely.
Wonderful. This question is also pertaining to the game. I'm going to kind of reword it so you don't have to be a broken record, but obviously with the students being tested, do you feel that everyone should potentially be tested that attends these games, whether they're a student or not, just anybody that has a ticket going forward?
I would love that. And when we look towards games in November in particular, that technology and capability may be there. The FDA has recently approved an antigen test called Abbott Binex Now, which is a rapid test. There's an associated app which will show proof that you've tested negative. That may be a possibility later in the season to ensure that folks showing up to present to the stadium are negative. We're waiting on technology to catch up so that we can have more events and do them safely. And my hope is that over the next month or two, we'll see progress in that space.
Wonderful. This next question comes from CBS Austin. It says, are we seeing an impact from the Labor Day holiday reflected in the new coronavirus cases? Do you think the uptick is related more to students testing positive? Again, I think a significant portion of the uptick is from students, that 10 to 29 age group. I think that we're waiting to see if that trend continues or if we can flatten it out again. But I'm concerned when we had an 83% increase in cases over a 2-week period. We started to see an increase before Labor Day. But when we look at our mobility data for Travis County, we saw increasing activity outside of the home prior to Labor Day as well. So we'll need to be very careful and very cautious now. And again, this is another reason why we would have waited a little bit longer to expand business openings. Alrighty, this is from Co-op Radio, and this looks like it's a quote from Mayor Adler, and they're asking if you support this recommendation. It says, Austin's positivity rate and cases are increasing among students over the age of 10. Infections among our susceptible populations are still too high. We need to act cautiously with these expanded openings. From Mayor Adler, and then it says, do you support this recommendation?
Yes, again, we wouldn't have gone to 75% right now. We would have waited at least until we were in stage 2 to really support that kind of significant increase in risk. So, our advice to our community is look at our stages. We're at stage 3. We don't feel that we're comfortable enough to move to stage 2 yet because of that increased risk, because of those increasing cases. Because we're taking other risks right now, including opening colleges and secondary schools. So I wouldn't go out to restaurants just yet, particularly crowded restaurants, and in particular with people outside of your household. If you want to go to a restaurant with your children, your spouse, that's probably okay. If you're in a low-risk category and your household is in a low-risk category. If you want to gather with friends, it's probably not the time yet.
We support the mayor's assessment. We've been working very closely with the mayor throughout this response, and he knows the data for for the city of Austin and Travis County. It's going to be important. Again, I will reference again all of the guidelines that we have on our website, but our risk-based guidelines, because we really need individuals to make the best decisions for them and their families. Our preference is, as we have noticed the mobility data, we've seen an increase in the mobility data, and we know that individuals are moving about more in the city of Austin and Travis County. So it's going to be important as schools are increasing the number of students that will be there, with our universities and colleges having class sessions, et cetera. It's going to be important for us to just take the most important measures for us as individuals to ensure that we keep our community safe.
Wonderful. Thank you for that. And this question comes from Texas Tribune. It says, why use a Salesforce solution instead of / in addition to NEDSS and Texas Health Trace? What does APH use NEDSS and Health Trace for?
So I'll go. So the NEDS-based solution, or the National Electronic Disease Surveillance System, at the beginning of this outbreak, it's a legacy system that was running really, really slow, and it's a system that the Department of State Health Services provides for us. Because of the slow system, we basically created our own system, and that was a Salesforce solution. At the same time, the state also created Texas Health Trace, which is also another Salesforce solution and platform for data collection and case investigation and contact tracing. Ours is a very similar product. We started ours before they started theirs, kind of at the same time. We have been talking about transitioning to that system and are working very closely with the state health department to migrate our current cases and data over to that system so they can have it on their system as well. But because NEDS is our kind of a legacy system, it just was not performing to meet the case demands that we have. I will say one portion of NEDS that we use is the electronic laboratory reporting system. Those laboratory results are reported directly to the state through the NEDS electronic laboratory reporting system, that portion of it. And so we do use that daily, and that's how we get a lot of our case and lab results to follow up on.
And let me just add to that. As Janet said, we started creating our Salesforce system. We encouraged the state to use that system, but do it statewide so that we could do case investigations across jurisdictions. And we're pleased that they selected that solution and have built that. What we're working through right now is the nuances of transitioning the data between the two systems. Our initial hope was that the state would be able to integrate with our system so that they would talk to one another. They have not been able to do that. So what that would entail is for us to transition from our solution to their solution. And these are the steps that Janet just described. We certainly want to use and be involved with the state system. They're working through some kinks associated with that system as additional jurisdictions have been brought on board. But we also want to make sure that we have unfettered access to our data, that we can provide data to our elected officials and to the public in the way that we've done over the past 6 months. Once we have those assurances, then we will look at completing a transition.
Wonderful. Thank you for that. This question comes from KXAN. It says, you have previously mentioned the 7-day average of new hospital admissions as the metric you're watching for reducing stage levels rather than the governor's focus on the percentage of COVID-19 patients and the overall hospital population. Explain why you're watching that number more closely.
So working with our modelers at the University of Texas, it became clear to us early on that hospital admissions was the best predictor of how things are going and where the trends are going. The percentage of hospital beds being utilized, is a useful metric to look at, but not quite as timely as the new admissions. We want to be able to respond quickly to significant changes. If we wait until we reach the 15% mark to take action, that action may be too late. Having said that, there are other measures that we look at, and we will continue to look at those, including positivity, ICU, ventilator capacity as well. We have learned since our surge in June and July that hospital capacity isn't the rate limiting step for us or for the state of Texas. It's ICU capacity. So, I'm hopeful that the state will continue to look at those triggers, and if they're going to use a hospital-based metric for making decisions, it probably should be ICU versus the hospital capacity.
Wonderful. A lot of good information there. And I actually think that is the last question from our local media this morning. So thank you so much for taking the time to answer those. We appreciate it more than you know.
Thank you for that, Hannah. Again, thank you, pool reporter. Now we are going to have our closing remarks and anything else our panel members would like to say. Stephanie, we are going to start with you, please.
Again, I'd like to remind everyone about our local mandates. We are very pleased about the governor keeping in place the mask mandate. However, we have our local mandates in place for the city and the county. We have enforced that you're not able to gather in groups larger than 10. And those are things that are still on the books for us as Austin and Travis County. So we want individuals just to make good decisions. And we've done so well, Austin and Travis County, and we want to continue to do that. Our goal is that we would like the positivity rate to come down. We'd like to go to stage 2 and ultimately keep our community safe. Just a reminder about our RISE funding that we have available. That funding is $2,000 per household, and it is financial assistance, and we're really excited about that. Lastly, we have testing available. If you have been exposed to an individual or you may have symptoms, please give us a call at our nurse line or 311. Go online and schedule you a test. We have a new location that is going to come on board next week in the Montopolis area at the Montopolis Neighborhood Center. And so we are encouraging you to use our sites. As a reminder, face covering, hand hygiene, and 6 feet distance.
And let me just remind folks that we are seeing a significant increase in new cases diagnosed in Travis County, primarily in high school and college age individuals. And also, if those individuals have been involved in social activities where masking and social distancing were not followed, or in extracurricular activities where masking and social distancing were not followed, we recommend that those individuals sign up and get a free test to ensure that they are not COVID positive. And if they are, we can protect other people in their school setting and in their household.
And finally, I like to just remind people that one of the best ways to prepare yourself for cold and flu season is to get your flu vaccination so that you stand ready for not developing a respiratory illness and are better protected for COVID-19.
Thank you. That concludes our media availability for today. We'd like to say thank you to APH Director Stephanie Hayden, Dr. Mark Escott, and epidemiologist Janet Pichette, and a special thanks to our pool reporter today, Hannah Rucker from KVUE. Thank you for joining us.